have you seen what it says on the back though?
I have not.
I really want to show this off.
All right.
Where's a good? So it says. Do you mind reading that off for me, Walter?
Sports area trip.
No.
Sports.
Sports are a trip.
Oh, sports are a trip.
What's going on, everybody? My name's Adele, sports neurologist at the UCLA Brain Sport program. On the UCLA Brain Sport podcast today, I'm very excited about this guest, Dr. Walter Dunn, UCLA psychiatrist, and someone that is in the know in regards to psychedelic use in medicine, and someone that is, I think, pursuing research in psychedelic use in medicine.
Correct.
Is that right? Is there anything else to add to that?
That's a good starting off point.
I think so too.
Yeah.
Yeah. So I think that, we can certainly just like dive into everything going on with psychedelic use in medicine right now. But I think establishing some sort of foundation into psychedelic use, what psychedelics are, maybe the history of psychedelics too, because it's a really interesting history, especially here in Los Angeles and Southern California, right?
Yes, absolutely.
Yeah. So, how would you define psychedelics, right?
Yeah.
First question.
Sure thing. Also, first of all, thank you, Daniel, for having me on here.
Thanks,
this is
man.
exciting topic. I've been talking about this extensively for the last probably year or so, probably even more so for the next couple of years, hopefully more than a couple of years. This is a big part of my career in research. So.
Fingers crossed.
So psychedelics. So, it depends who you talk to. I think the term psychedelics right now in the general public is being used fairly loosely. So compounds like psilocybin, DMT, LSD, these are considered classic psychedelics based off of their, I don't want to throw too much jargon, but just a certain receptor they hit in the brain. But one of the major compounds that people are very interested in now is MDMA. Right. So ecstasy, Molly, for those in the kind of know.
Yeah.
And that's not considered a traditional psychedelic per se. However, when you read about it in the news or people are talking about it on the street, they're probably incorporating MDMA kind of into that term. Ketamine, which has been around for a very long time, but within the last probably 5 or 10 years or so, increasingly used in medicine, or actually in the psychiatric space.
Right.
Some people will consider those quote unquote psychedelics, but that's technically not accurate. So again, it depends who you talk to. If you're talking to the straight hardcore scientists, they'll say, okay, anything with a 5-HT2A receptor antagonist profile, that's a traditional psychedelic, and that'll include DMT, psilocybin, LSD. Those other compounds are different. So MDMA is considered what they call an entactogen, and then ketamine is what they call a dissociative.
Right. So, but still, I think what is a general definition that I think a lot of people that aren't necessarily in the medical profession could relate to in terms of defining what psychedelics are, right? Because it's really important, right? Because I think a big history surrounding the lack of research in psychedelics is the fact that psychedelics get put into this box where cocaine also gets put in, where all these other drugs get put in, right? Yep. And that limits their research and their consideration for potential therapies that might be beneficial.
Yep. Yeah, so all these compounds I've listed off, with the exception of ketamine, are what they're called Schedule I drugs, right? So what the DEA, the Drug Enforcement Agency, has deemed no legitimate medical use.
Right.
And so you can't prescribe it, you can't access it you can't prescribe to anybody. You can use it for research, but the hoops you have to jump through are extraordinarily difficult.
Yeah.
And that's one of the things that has slowed down research. So I think when people think about what are psychedelics, it's probably drugs that have a psychoactive component that have been used for recreational purposes, that are potentially abusable, but now are being not necessarily modified, but are being used in a certain context with certain safeguards so that they potentially have a therapeutic effect.
Right. But psychoactivity, that's a general term.
Very general.
Right?
Very
like
general.
Smoking weed, right?
Yeah.
That can be a little bit psychoactive.
Absolutely.
Right. Yeah. So, but we know, I don't think marijuana is considered a psychedelic, right? So sort of like, what are the things that have to occur when you take a compound for it to be deemed a psychedelic? Does there have to be a hallucinogenic experience, for example? Does there have to be a increased sense of oneness with, your environment around you or with other people within your circle,
Yeah, I think that really gets into the crux of the issue, which we've discussed about previously, about the importance of that subjective experience. And at least the people who are in the space right now who are applying psychedelics for medicinal psychiatric purposes, one of their major beliefs is that the quality of the experience, that subjective experience from the user, as you mentioned, is this kind of oneness with the world, increasing a sense of closeness or empathy to another human being. Those quote unquote positive aspects of the experience are essential for the therapeutic efficacy of the quote unquote psychedelic. So I think loosely, that's probably how a lot of folks in the space are using the term psychedelic, is that subjective experience is important for the therapeutic aspect of it, and that's what they're harnessing when they're combining it with a psychotherapy.
Got it. Okay. So that can potentially be a requirement for it to be defined as a psychedelic if you can elicit that experience.
So one, again,
I know it's tough.
Yeah,
I know it's difficult, but I think it's important.
A subset of folks I think would be very I don't say rigid about it, but I would believe, yes, you need to have that subjective experience.
Okay.
On the other side, some folks will tell you that no, it's really not about the subjective experience. It's about which receptors you hit, and perhaps if you hit those receptors, but you don't have the subjective experience, you can still call that a psychedelic. But I think I would say that most people kind of practicing in the space right now really believe that yes, that in what they call an ineffable experience, right? Something that really can't be described in words,
right,
is the critical component of that psychedelic experience.
Got it. So the history of psychedelic use is really important too, right? Because in the 1950s and the 1960s, it was psychedelics were being studied. And there was some really beneficial results noted then, right?
Yeah, absolutely.
And unfortunately, it kind of leaked out of this medical or research setting, and it was kind of being used then in the counterculture in the 60s at that time. And, because of that, it seems like the government kind of cracked down on all drugs and considered that to also be sort of, like I mentioned before, in this box of just all this stuff that got placed into this black box of things that are bad, things that should be banned and no one should do. And that limited its research. So, during that time, there's basically no research in that field. And then now we're having sort of this advent of the resumption of that research. And it's really, really exciting. But can you speak more towards the history?
Sure.
Yeah.
So, we should really acknowledge where this model came from, where these compounds, really ancient compounds, right? Especially we're talking about things like psilocybin, which are from a fungal source. So we have known there's recorded history or evidence of recorded history that this has been used over 6,000-7,000 years ago.
Right.
So a common image that's if you look at books talking about the use of psychedelics is this cave painting from the plains of Algiers, and it shows a shaman-like figure. And he or she has a mask on that looks like a beehive, and then along their upper extremities and lower extremities, there's these like little appendages sticking out. And the interpretation is that these are actually little mushrooms, potentially the mushrooms where psilocybin comes from.
Right.
And the idea is that shaman-like figure was using these psilocybin mushrooms to induce this mystical state in their subjects for whatever purpose. And we know that they've been used for medicinal purposes, for initiation rites, for sacramental uses. So this goes back thousands and thousands of years.
I think they've actually found residual, I don't know if it was psilocybin component, but certainly a psychedelic compound, residual compound of whatever psychedelic it was in old vases or some old, carrying equipment in, ruins, which is incredible.
Yeah, absolutely. And so I think we really have to acknowledge the indigenous cultures that really discovered the therapeutic properties of this.
Yeah, absolutely.
And then fast forward to maybe the history of Western culture. So exactly. So some important dates in quote-unquote psychedelic kind of development. So 1912 is when MDMA was first synthesized by Merck Pharmaceuticals back in Germany. Of course, it really didn't catch on until the 80s and 90s. The other major date in psychedelic history is 1938. So Albert Hofmann from Sandoz Pharmaceuticals, that's when he synthesized LSD. And it was LSD-25. I think it refers to the 25th compound that he was trying to synthesize. And it wasn't until a couple years later that he quote unquote accidentally took a little bit of it and then noticed the subjective kind of effects of it.
I'm sorry, you're referring to Dr. Stanislav Grof?
Oh no, this is actually Albert Hoffman.
Oh,
So
okay.
the individual who synthesized LSD.
Got it. Okay.
And so that was really kind of when it started to kind of gain a foothold, because he realized, well, this potentially has a therapeutic use.
Okay.
And so Sandoz was actually handing out, distributing, giving out LSD to psychiatrists, to physicians, for use in research and therapeutic application, to see, can you use this compound to help people? And
Right.
so yes, 50s and 60s, these compounds were unregulated. People were using them all over the place. Big names in Hollywood. So that kind of brings us to kind of where we are, Los Angeles. Cary Grant, right? He is the I guess the Brad Pitt of his time.
Right.
And he had not just one experience. He had therapeutic sessions that were catalyzed or augmented with LSD.
Mm.
And he really thought it changed his life and improved his mental health. And he actually approached a magazine called Good Housekeeping. I think that magazine may be still around now, but right, it's like the Time, or just a very casual journal. And he talked about his experience with LSD.
Yeah, that's incredible. And then we have the 60s,
Mm-hmm.
the crackdown.
Yep, the crackdown, the counterculture.
Counterculture.
Timothy Leary and his use of these compounds at Harvard. Some interesting experiments there. However, a little bit too liberal with his use of these compounds. Right, he was giving to undergrad students,
Right.
uncontrolled situations, and I believe it was. Oh man, I should have looked this up. So Ark Linkletter, I believe, a very big journalist at the time. I believe his daughter unfortunately had a bad experience with this, and she might have died. Actually, we'll have to go back and check.
Okay.
But a Congress person had him testify in front of Congress about his daughter's bad experience with
Right.
LSD,
Right.
and that was one of the many kind of events that helped catalyze essentially the shutdown
Right.
of these drugs. So
Right.
the Drug Act of 1970 outlawed these. They all ended up quote unquote Schedule 1, no legitimate medical purposes or applications, and so essentially that was the end of it.
Right.
And then for another 20, 30 years or so.
So then now we have the sort of advent where this is the research and use of psychedelics in this sort of context is now coming into the fold.
Yes.
Are you able to put your finger on exactly why that is? Like, why is it just a shift in the culture? Or?
Why now?
Yeah, why now?
Right.
Yeah.
Yeah, so this was certainly something that was not overnight. So another seminal event, 1990, was when Rick Strassman did the first legitimate study, FDA-approved study with DMT.
Right.
Now, he wasn't doing it in a clinical population, but there was a hypothesis, and I believe this is actually true, that your pineal gland actually makes like micro amounts of DMT.
DMT, right.
DMT.
Right.
And then I think it was 1996. So Charles Grob, here of UCLA, Harbor UCLA,
Yeah.
he's been interested in psychedelics for a very long time, and he actually conducted the first legitimate clinical trial for MDMA in 1996.
Okay.
And since then, he's been interested in psilocybin, mostly for use in end-of-life type of situations.
Right. And we'll talk about that.
Oh, yeah.
Yeah.
And then, of course, we have to acknowledge the role of MAPS, the Multidisciplinary Association for Psychedelic Studies.
Mhm.
So this was an organization started by Rick Doblin
Right.
back in the 1980s, and he and his I don't want to use the word believers, but the folks who really understood, appreciated the therapeutic potential of these compounds, since the 1980s has been moving, towards this idea that how do we get these compounds approved through kind of standard accepted regulatory processes,
Right.
so that everybody else can reap the benefits of what we already understand.
Right.
So they've been working for the last 40 years on this.
Yeah.
And
But I think that's in conjunction. So there's this sort of research side where you're legitimizing it via, the regular standard channels of research,
Mhm.
right? But
Yeah.
then in addition to that, there's certainly a cultural shift, I think, that's happened in our society from, the 80s
Mhm.
to, 2021 now,
yeah,
right? That potentially might be more accepting, might be more open to legitimizing psychedelics for the use in medicine.
yeah.
Right.
I think another thing has to be kind of pointed out is on the regulatory side, the federal agencies responsible for these to allow these research studies. I think when the story is finally told, I hope the medical officers and the individuals at the Food and Drug Administration or agency are given credit for seeing the therapeutic potential of these. So ultimately, when you want to run a clinical trial, you got to go to those folks and go, hey, look, this is what I want to do with these compounds that have been previously scheduled 1.
Right.
And if they've got some kind of hidden bias, they'll be able to shut it down. But
Right.
I think these medical officers appreciated that. Look, there is potential benefit for this. There's certainly a need, right? I think a lot of it's driven by the need.
Right.
That look, for these conditions such as treatment-resistant depression, PTSD, where we've thrown everything we have at it, and a good 50 to 60% of folks still do not achieve what we call remission after
Right.
our standard treatments. We need to have more tools out there, and I think they recognize that potentially these drugs used in the right context in the right hands could be potentially therapeutic, and you could minimize the potential harms. We need to see if this can play out.
Right, absolutely. So let's start with our first psychedelic of choice. I think we should just start talking about psilocybin.
Sure.
Right. I think psilocybin is just really out there in the media a lot, and there's a lot of evidence substantiating the use of psilocybin in this context.
Yep.
The first study that really struck me, and it was probably the first study I came across, was the use of psilocybin in patients that had sort of terminal diseases.
Mm-hmm. Yeah.
Right. And the fact that a pretty big dose of psilocybin really altered their perspective on their disease as well as their impending death,
Mm-hmm.
right? Because that's what they were going to be facing.
Right.
And it was just one dose,
Mm-hmm.
right?
Yeah.
And was it in the context of therapy, or is it just one dose and then following up on how they felt about their condition?
Yeah, so that's a good point. So all these drugs, and even though we've been really focusing on the drug itself, or the medicine as I call it, I think it really has to be acknowledged that it's the quote unquote therapeutic container in which they are delivered is,
Right.
is critically important. And in fact, a lot of practitioners will tell you it's really about the therapy,
Yeah.
right? That is the driving mechanism. The medicine, the psychedelic, that's a catalyst, or what I like to call it, kind of supercharges that that therapeutic conversation. So it's really the combination of the two. If you just had the psychedelic alone, I think you would not see the type of benefits that you're reaping, and potentially you could see more harms. If you just did therapy alone, I think some people could get better, but certainly not the numbers that you're seeing with these psychedelic assisted therapies. It's really the combination of the two.
Yeah.
And as you pointed out, what's really amazing is that in just one session with one drug dose, but of course with multiple psychotherapy sessions associated with it, you're able to get these profound effects that are highly durable and sustaining.
Right.
Right.
Yeah, that specific study, I think, it wasn't only within days or within weeks of them doing that dose that they had a perspective change.
Yep.
Right.
Right.
And that kind of speaks not necessarily against, but it gives credence to the actual effect of the administration of that drug, right? Because therapy for like a week,
Mm-hmm.
right? How much will that shift your perspective on everything that you're dealing with, right? But nonetheless, I think, then when they went back after an extended period of time, I think a few months, and they noted that sustained effect,
Mm-hmm.
I think potentially that's where the therapy plays into that, right? Because a lot of people after their what I hear is after their psilocybin experiences, they keep thinking back on that experience,
Mm-hmm. Yeah.
right?
Yeah.
So, and that it seems like that provides a really good opportunity for therapy,
Mm-hmm.
doing therapy on a regular basis, someone that you can speak to regarding your thoughts on your experience, right? Which provides a really good opportunity to really think through things that are potentially tolling and anxiety related and different things like that. So a professional that understands that experience.
Mm-hmm. Yeah, I think you hit upon this point. Again, this is going to probably come up repeatedly during conversation, but the necessity of of that subjective experience, right? And again, open question. Studies are going to be done to try to tease this apart. But if you think about the role of just in kind of your everyday life, when you look back to events in your life that are meaningful to you, right? Birth of your child, death of a parent, the highs and the lows. It's really about that emotional connection you had with that experience.
Right.
could you really take that away and still lead a meaningful life? I don't know. I don't think so. So I think that's where the multifaceted mechanism of why psychedelics work. I think that the subjective part of it, the story part of it, I think that's why we see such durable effects. So we know that with just an acute administration of a psychedelic, there's this afterglow effect for maybe like a week or two afterwards, right? Even maybe a couple of weeks. But as you mentioned before, when they follow these people up for months, they're still doing better, and the afterglow is gone. And I think it's really the narrative that develops from that intense experience. That's what they're able to look back to and reference, and I think that's what's able to kind of continue their improvement, their recovery, is that they have that reference point in their life, saying, that's when I realized that, I'm not alone in this world.
Right.
I'm connected to the universe, and they grab a hold of that and they hold on to it, and that's what's able to provide resilience and continue them on their path of recovery. So, kind of referencing the importance of the narrative. That's I don't want to say uniquely human trait, but it's a very important part of being human.
Yeah.
We have an entire industry here in Los Angeles dedicated to telling stories. Right. Quite a big industry, and so I think that really points to why having a narrative or story surrounding your recovery is critical.
Right.
And when you hear folks who have benefited from psychedelics, I think that's what's most striking about their testimonies, is that people don't just say, I not to speak down to our traditional antidepressants, but I rarely hear people say, I took a Prozac or a Lexapro. And
you prescribe these medications
absolutely,
yourself, right?
Absolutely.
So it's not like you're speaking from an outside perspective. You're prescribing these things all the time.
I prescribe them all the time.
Right.
They're effective. They're safe. And even when people get better, they usually don't talk about a life-changing experience or turning their lives around necessarily.
I think that something that psychedelics help you do, and correct me if I'm wrong, you're the psychiatrist at UCLA, not me, but there's this sort of shift that occurs that, let's say it's related to trauma in your past, right? So you keep wanting for that trauma to go away, right? Mm-hmm. And you want to be administered take anything that'll just make it stop. Yeah. Just make it stop, make it go away. Mm-hmm. And, I guess, and that's what SSRIs do. That's what these sort of standard of care medications potentially do, right? It dubs down those feelings and those effects secondary to that trauma.
It blunts down
It blunts that down.
Yep.
Versus psychedelics, you're not doing that, right? You're doing what I think most people think would be a healthy thing to do, how you overcome trauma, how you're triumphant over trauma, which it's you face it, right? And you defeat it, right? By confronting it and moving past it, right? And therapy by itself is how you incrementally do that. But is psychedelics a shortcut? I hate to call it a shortcut because shortcuts are always bad, right? Shortcuts are always regarded as bad things, or rather a supplement to be able to address that and slay that dragon. What do you think?
Yeah. So, when people talk about psychedelics working really quickly and it being a shortcut, if you look at the amount of hours and energy kind of put into it,
related to therapy.
Related to therapy, just kind of how much energy is required in terms of having two therapists in the room, having these extended medicine sessions, which are 6 to 8 hours long.
Right.
That's actually one of the big debates in the field right now, is that with this amount of energy that you need to put into it, or resources you need to put into it, is this scalable once it hits the real world?
Exactly.
Can everybody who needs access to it really get access to it?
Yeah.
But getting back to your original question, and we can talk about the implementation kind of challenges later.
Yeah.
But this idea of a shift. So certainly we know people can recover from trauma with therapy alone. Absolutely, people get better, right? Yeah. Gold standard treatments for post-traumatic stress disorder, CPT, cognitive processing therapy, PE, prolonged exposure. They work, absolutely. But there is still a large portion of the population where, for one reason or another, not quite as effective or have been unwilling to engage in that process. Right. And so I think psychedelics is that catalyst, as you mentioned, and it helps provide that shift. So as far as, ways to address trauma or overcome trauma. I think it's, the role of the traditional antidepressants or SSRIs versus what psychedelics do. So, Robin Carhart Harris, now at UCSF, has this very interesting model where our traditional antidepressants hit the 5-HT1A receptor.
Right.
And that, as you mentioned, kind of blunts down or suppresses the intensity of that emotional reaction. Whereas activation of the 5-HT2A receptor, which traditional psychedelics do, that activates an adaptive kind of mechanism or process that helps you develop skills and behaviors and cognitions that'll help you overcome the trauma. So to your question earlier about people wanting the trauma to go away, it's really and there are areas of research where can we erase the trauma, right? There are areas of research doing that, but this is not one of them. This is really about changing your perspective about the trauma so you see it in a different light, right? So your trauma is an elephant in the room. And it's really taking up a lot of space in your mind, in your life, and in your soul, and you're constantly seeing it from one angle, and it just looks the same every time. I like to think of psychedelics as allowing you to change positions or shift, as you call it. Maybe I look at it from the side, from the back, from the top, from the bottom, right? It's like, oh, it looks different.
Right.
This was maybe not an entirely quote unquote negative experience for me. There was something positive to be gained from it, or at least I can see it from a different way that it's not so encompassing or soul sucking for me.
Right.
And so I think once it loosens that up, right? People talk about psychedelics providing some flexibility in terms of perspective. Once you loosen that up, that you can quote unquote move past the trauma. It's always going to be part of your life. It's always going to be there.
Yeah.
But it's not going to kind of take up so much of your energy and result in or cause so many negative kind of behaviors in your life.
Right. I think it's really striking in the context of PTSD, right? Because at our program, we deal with a lot of patients that have history of TBI and PTSD secondary to terrible event that happened in Afghanistan and Iraq, right? But what happens is this sort of even trying to address that event in someone with severe PTSD, they can't go there, right? It causes a dissociative episode, or it causes them to flip out and have an emotional response, right? And you can't actually address it.
Yep.
It just seems like there's this huge wall up that you just can't get past.
Yeah.
And I always thought that psychedelics would be a potential tool to be able to, either climb over that wall to be able to address it without having those episodes or those experiences.
Yeah, that's a great question. I mean, that's an excellent point. And that really kind of highlights where, kind of maybe to your question about why we've been able to move so quickly. Well, I don't want to say quickly, but why we've been able to kind of maintain this steady pace and energy towards potential implementation is that really the veterans. I think it really has to be, they have to be acknowledged that a huge driving force behind making these compounds available are the veterans coming back from Iraq and Afghanistan, because our standard treatments they have been effective, but again, a large proportion of them has not worked for. And there have been a lot of veterans who have gone outside the U.S. to experience these compounds, and they've been helpful. And so there's a lot of a lot of energy and many organizations kind of working behind the scenes. So talking to the major kind of players, people in the FDA, people in the state legislatures about how can we make these available here in the United States, quote unquote legally. And yes, I think their situation in terms of the intensity of that of the emotion from those traumas that they experienced. Yes, for a lot of them, the activation energy is a barrier is too high to talk about it in these traditional therapies. But with the help of psychedelics, specifically, what's been most promising is actually MDMA. Has allowed them to open up about it, to talk about it, and I think it's from that. It is from that, I think, process where they're able to see their trauma from a different perspective and associate a different emotional range with it. Typically, it was about fear, anger, but under the influence of MDMA, they're able to recount their experience, but feel love and compassion and empathy, and realize that the experience or the memory of the experience doesn't have to be all negative. I mean, now look, the content is negative, but if I can see it from a different perspective, perhaps I can live with it in a different from a different angle.
The way you've described it to me, describe that process for me before really well, like a really cool analogy, which was the ski slopes.
Yes.
Yeah. Where it was, you're constantly thinking a certain way, right? And the context of PTSD, so you had this event and you've been thinking about this episode or this event and then how it relates to you over and over and over again for such an extended period of time, right? I'm sure you see people after they've had the symptoms of PTSD for months or years even, right? So they're constantly going down this slope, right? Constantly going down the slope. And then what psychedelics do, right? It opens up, a brand new fresh powdered slope, to go down the mountain.
So the analogy is actually that's actually Carhart Harris's analogy,
right.
And that's actually with psilocybin, so it's a little bit different than MDMA, although I would not be surprised if there was some convergence of a mechanism at play, especially in trauma.
Right.
But his idea is of this idea of brain entropy, right? And so psychedelics catalyze this event where you're able to have a more flexible way of thinking about things.
Right.
So as you mentioned before, a lot of folks with PTSD or just even depression have these negative cognitions either about themselves or the world, and they constantly ski down the same path.
Right.
And these grooves that they make in their minds or their psyche get very deeply ingrained. And it's very hard to, and so you can imagine, years of kind of skiing the same path, and suddenly you go to a therapist, and the therapist is trying to get you to think a different way. It's very difficult to get out of those grooves are deep. Those grooves are deep. So what can you do? And so one model is that with the use of psychedelics, you can kind of reset that slope. You have fresh powder now, and so in combination with the therapy, right? So the idea is that potentially inherently, in one model, is that inherently resetting the slope is not necessarily something positive. It just allows you the opportunity to travel a different path.
The reboot,
button, right? But you got to be, you need to have a guide, or you need to have somebody potentially help you move in that more adaptive way, or think in a more adaptive way. So I think that's why,
because a reboot followed by the same thinking that you've been thinking the last 6 years or whatever that got you to the same place you are now. It's just going to lead you to exactly the same end result.
Exactly.
And let me add something that's really, really cool, that a connection that I make in my mind, with functional MRI imaging in these people that for PTSD, right? This chronic low self-esteem and this sort of way that you're thinking about the event. In functional MRI imaging, there's hyperconnectivity that is noticed in these patients, right? Between the amygdala, prefrontal cortex, and other areas of the brain that aren't present in people that don't have PTSD and don't have this sort of way of thinking. So, this analogy is cool, right? When it comes to, this slope that, you continue to make because you're going down the same slope. But actually in functional MRI imaging, you can actually see that increased connectivity between these portions of the brain secondary to you constantly thinking like this, right? And then when you try to think outside of that slope, when you try to take that slope outside, it's just so difficult because that connection has been so strongly built, right? So it's not only like this analogy that you're making, but actually in the functional MRI imaging, we've seen that. And that brings me to sort of my next question regarding this new advanced imaging, the functional MRI imaging in the context of someone on a psychedelic like psilocybin. Can you talk about that a little bit?
Yeah, so Carhart Harris has done a lot of research for folks who are under the influence of psilocybin, and then he also looks at people the week or month afterwards to see kind of what are the brain changes from functional MRI. And so one of the most striking things that they see when people are under the acute influence of psilocybin or these psychedelics is that there are connections being made that you don't see in quote unquote kind of normal human beings, right? So and this thought potentially that's what kind of resets your system or allows you to see things from a different perspective. And certainly that's probably one of the mechanisms as to why you have this like mind-blowing kind of intense experience that you've never kind of experienced before, is that parts of your brain that normally don't talk are like now talking to each other. And then afterwards, you see, especially for folks who are improving after that experience or that treatment, is that activity in portions of the brain, such as the amygdala, are actually lower post-treatment than pre-treatment.
So, but that's specifically for MDMA, not psilocybin.
Oh, that one
right?
is the one I'm referring to is actually for psilocybin.
Oh, okay.
Psilocybin.
In the amygdala as well.
In the amygdala. So, the thing, and I'm not familiar with this literature as intimately, but I would not be surprised if for MDMA and for psilocybin, if you're treating people with PTSD, that if you take a look at folks who are just doing better afterwards, regardless of what kind of receptors were hit from your psychedelic during the treatment session, that you might probably see a convergence of these common themes of less activity in the amygdala, right? And that would make sense, right? Because you're no longer so hyper vigilant about the world around you. You're no longer looking over your shoulder every 30 seconds.
Right, because let's just explain for people. That's the sort of function of the amygdala, sort of this reptilian side of the brain, right?
Yeah, your lizard brain.
Right, your lizard brain, where you develop this the fear processing, right, is where that's involved in, especially with some of PTSD, right, where they become really fearful, really hyper vigilant about fireworks. In a civilian context, right, would be something that it would be a good example of that.
Yeah.
So MDMA decreasing activity in the amygdala, right, would potentially, it makes sense when you say, okay, well, let's do that in conjunction to therapy so that now you can address those things without having this sort of exaggerated hypervigilant response to whatever it is that we're talking about, right?
Absolutely.
It makes total sense.
Yeah, it makes total sense, right? So yes, I mean, look, we're beholden to our amygdala, right? It's kept us safe for millions of years, and it will keep us safe for millions of years in the future. And so we're biologically wired to listen to our amygdala, whether we like it or not.
Right.
And so you can imagine if somebody's in session talking about their trauma and their amygdala's firing really hot.
Right.
Their instinct is to stop talking about it. It's a very uncomfortable, aversive experience.
Right. We're fighting a part of our brain that's been developed over millions of years from an evolutionary perspective.
Absolutely.
That's been a protective mechanism.
Yes.
So it's very, very difficult to just just don't feel that way. Just don't have that reaction, right?
It's like, don't be angry, don't be afraid.
Yeah,
right?
I'm fighting evolution over the last million years. I'm sorry.
And the other thing to remember is we're also the descendants of folks with probably more active amygdalas, right? So if you can imagine back in the day, you had your ancestor and their friend, they were walking through the forest, and there was a bear kind of stalking them, and then your ancestor with the hyperactive amygdala just had their spidey senses went off, and the hairs in the back of their neck kind of went off, and they said, okay, I'm getting out of here.
Right.
Their friend with the less active amygdala, for whatever genetic reason, I don't know what you're talking about. I'm going to keep walking in these woods. And they got eaten by a bear, and they were no longer able to pass their genes on. But your ancestor, right, with the kind of more active amygdala, was able to kind of pass the genes along.
Yeah.
But a society advances a little bit further than our biology does.
Right.
So, unfortunately, I think a lot of our psychiatric disorders are secondary to inappropriately active amygdalas, anxiety disorders, PTSD. Because certain things in Los Angeles are even though the amygdala is firing, it should not be life-threatening. Right? We should have a more tempered response. But that's the nature of our biology.
The amount of likes on an Instagram post. Should not be firing your amygdala as much as it does.
But it absolutely does.
We're getting off topic a little bit.